we hit the Facebook Live. It is weird because I'm wondering if people want to ask us questions. I invited a
No,
lot of.
actually, you asked a question, I answered. You
That's
represent
about
other,
it. I'm a
yeah,
million people. I'm a million people, right?
yeah, yes.
Facebook, they had. I put up the ad, but it took a day before they were ready to run it. It ran from this
I
early.
invited a couple of people. They said that they're coming.
Yeah, a lot of my friends were interested too. But not, it's always like not everybody has the time or the phone or the computer doesn't work or something. So many things about it. All the technology. But doctors now are doing a lot of remote doctoring. I know they even do surgery with remote, and of course we're doing the classrooms remote with
How
the
can how
students.
can do the surgery remotely? I just wondering.
Well, I think they have an expert or a very experienced surgeon, and then the new people will listen to him, and they have the camera on the patient, something like
Oh,
that.
supervising. Yeah.
Something, yeah, yeah. And then remote medicine. I mean, I think that some doctors and like the public health, that if I have a problem, I can talk to a doctor. And of course, people want privacy when they talk to their doctor. There's a lot of things that I'd be thinking, well, I'd love to talk to my doctor, but not in front of everybody. So that comes up, I think. But we were going to talk today about the respiratory lungs
Yeah.
and maybe the smoke and the COVID as it enters and how the Chinese medicine approaches the health of the lungs. Um,
So we should start now. For some reason, I still did not load.
yeah. Now.
Is that good now?
Oh, I'm good on this side. I don't think you're up on Facebook Live yet. Uh, it doesn't say on mine.
Yeah,
But
it is. It is
it
on
is.
Facebook Live.
Okay.
Yes.
Okay, good.
Yeah.
Well, I'm Julian Phillips in Vallejo, California, and I'm a journalist retired. And I've known you several years now, Doctor, but
Yeah, at least 5 years, as far as I
yeah,
remember.
yeah, I hardly never get to see you. And tell us a little of your background about the clinics. You're 25, 35 years experience Chinese medicine, and you have two clinics in San Jose Bay Area.
That's right. Yeah. So
Yeah.
in my whole life, I mean career life, I've been practicing traditional Chinese medicine through practicing in treating patients and also teaching in different schools and also through workshops, seminars. And right now, I'm doing the webinars to share the knowledge I have and I learned, I practiced. So to benefit people's health well-being, especially during this special time, it's important keep our health on the first frontier strong.
Oh, for sure. Yeah. That today is more important than ever, and I think many like Western, they don't understand that there's a difference of the Eastern medicine, right? So
True.
we're having like the Chinese acupuncture, massage, and a whole bunch of other services at the two clinics, Milpitas and San Jose, I guess. How
Yes.
many webinars have you done?
I think that since this year, the pandemic, since March, probably I did about 20 to 30 webinars on
Good, great.
different
And
topics. Yeah.
how long is each one? Is
It's about 1 hour. So I
Wow. And so you have
taught,
like the cameras, and then they talk about problems, and then it goes onto the internet.
yes, so yeah, through webinars. So I'm
Wow.
able
Does it go?
to, yeah,
Tell,
to do
tell
that.
me more. Tell me more.
Yeah, I think that, right now we are home. So the situation is so different from usual. I mean, we are less active. We probably eat more, probably more stress, and even for the kids and home, and also work from home. So you just whole different type of different dynamic, between
Yeah. Yeah, like
family
because you're
members.
indoors and like I know I'm not getting exercise as much, and I do eat. It's hard to work at home because you don't want to work if you want to do something else than work at home.
That's true.
And when you're in your home, there'll be toxins in the environment, like in the walls, or mold is respiratory, and this type of thing. Um, so from the lung damage, today we were going to talk about lung damage and lung health. And would this be something that would be handled strictly acupuncture, or is it what methods do you use?
Yeah, strengthen the lung, detoxify the body's toxicity, from smoke, from, inactive, a lot of mucus accumulated in our lungs. So it's time to expel the mucus, right? So one of the things we use the Chinese herbs, which is actually is tangerine peel, the tangerine peel, and actually the preserved tangerine peels. So when it's become dark color, not yellow, orange again, you know, the longer, the older, the you preserved, the better. So that is a very good remedy for the lung. So you can cook the tangerine peel.
Tangerine peel
Yeah,
from.
peels, tangerine peels.
I
Yes,
think my wife got a bag of just regular tangerines.
yes, regular tangerine, not orange, just tangerine peels. Yeah, the fresh one you can make a tea from the tangerine peels. And also you can, when you cook, when you cook vegetables, some kind of meat, you can put it in the stove, in the pot
Well, and so
together.
the let's say I got tangerine peels and I boil them and then I'm breathing
Yes,
in.
breathing in, yes, breathing in. Use the warm steam with tangerine peels.
No kidding.
Just the hot bowl in front of you with tangerine, the steam. So you can
Yeah.
inhale through your nose
Well, I
and
use
through your
like there's
mouth.
menthol and there's oils like eucalyptus oil, menthol oil, and you could put it in the steam. I know when my little baby was growing up, and he'd be coughing and coughing, and we use the steam, and he breathes with
Yeah,
menthol usually.
yeah.
Yeah.
So yeah, that's actually, especially for babies, you don't want to
Yeah.
give too much medicine, right? So for babies, for people have a usually allergy, allergy, sinus,
Oh yeah.
asthma. So this is very good steam,
Yeah.
tangerine skin steam, like you say, eucalyptus leaves, oil, or yeah, that we will do it. So that's
Yeah.
the best way.
And the
Direct
problem mostly with the
inhale.
lungs is mucus. But I mean, I was listening to doctors saying about the COVID virus, and he said that when it gets down into the lungs, it's mostly going to be like pneumonia, and it builds up a lot of mucus, and then you can't use your lungs properly for oxygen, right?
That's right.
Yeah, yeah. So,
Yeah,
but
it's true. The airway usually is dry and the mucus accumulated with mucus. So how do you dissolve the mucus, moisturize the airway? It's important. I think the steam, warm water steam is right on with some herbs in it. It's
uh,
really effective way.
oh yeah, yeah. I imagine. But would you use acupuncture? Let's say I have pneumonia, and
Yeah. Mhm.
tell me more.
Actually, they did a research in China during the COVID-19. We used compare groups. One group with pure Western medicine treatment, and one group added herbs, acupuncture. So
Uh,
actually, the survival rate is much higher than lung use group. This is a controlled
well, the
group.
Western medicine is going to do what? I mean, the Western medicine, they're going to use chemical to dry my lungs, like steroid, prednisone, Western prednisone, or because like sometimes with the lungs you use like a zinc
Mhm.
steroid, make it stronger. Because when my wife had pneumonia, they gave prednisone and breathing. So that's Western, but it's like a steroid, is not. I don't know. Like, let's say I'm a firefighter on the
Yeah, I
line.
think Mhm. Go
Please.
ahead. Yeah,
Well, it just
yeah.
like you're the doctor. I don't know.
You just said. Yeah, yeah. I think the steroid has its function. You know, it's acute, really congested lung breathing. So steroid can calm down the inflammation. But
Yeah.
ultimately, you want to use treat the root cause of the congested mucus in the lung. So that's actually we can use some herbs, acupuncture, some qigong exercise to help that part.
Do you have breathing exercises? You doing
Yes,
breathing?
breathing exercise like deep
Yeah.
breathing in,
Yeah.
and then also you can do a qigong exercise like yeah, that's going to give you some expand the lung, and that would be good for clean the lung.
Expanding. If I'm a firefighter and I'm going out on the fire, because smoke will kill you, inhalation, right? And you die
That's
with
right.
that a lot when it's smoke.
Mm-hmm.
Um, and let's say I'm in the hospital, so I want to heal the lung after the damage is done. What would Chinese medicine do? Maybe pretty serious with
I
the.
think that yeah, so mhm. Yeah, you can use ginger as well, fresh ginger. Fresh ginger, just take a drink ginger tea or steam, both way, so the way open the passages, air
Uh,
passages.
yeah.
And also you can press these pressure points
Uh,
right in the middle. Oh,
uh,
actually on the edge, not inside edge. Just tap. So this one on the edge.
and that's acupressure styles,
So you can
right?
tap. Okay, pressure points. And
Acupressure.
also you can do this part,
Yeah.
forearm. Just move a forearm.
Now, of course, most people don't know how to do that, so they want to learn how. Should they go to practitioner? Should they get a
Yeah,
book?
most practitioners should know how to stimulate the lung energy by pressing the points or
Uh,
use acupuncture. Yeah.
uh, and so I think with what I learned about acupuncture is that I have negative chi energy or clogged up
Congested qi, congested
congested
energy.
chi.
So we need to open. Doesn't matter
Yeah,
is in the lung or in the other organs.
yeah, yeah, yeah. Well, the lungs, of
Yeah,
course,
we
you're
need to
going to
just
get
open,
oxygen.
block the energy.
Yeah, yeah, and
Hmm.
like,
Yeah, yeah,
please tell me more. Tell me more. It's not me. I mean, I'm going to go to a
yeah. Because the lung,
practitioner.
the time is yeah. Practitioner will identify if your lung energy is blocked or is deficiency. If it's cold or heat. So if it's cold in stomach in your lung, you cough with clear white mucus.
Uh,
If the mucus is yellow thick, it's too much heat. One is cold, one is heat. So we need to identify what is which type of the
uh,
flame in your lung.
uh, so deficiency is different from inflammation.
Yes,
I have done.
inflammation usually have a yeah.
Tell me more.
What is yeah? Inflammation is like a heavy cough, feel pain everywhere.
Yeah.
Deficiency is like half cough,
Uh,
weak, cannot cough out. And the important is when you have a lung congested lung
uh,
problems, lung organs not in function. Usually, you have to also make sure you have a normal bowel movement. You don't want to have a constipation because the two organs are connected.
and it connects to the lung function, the successful lung function. You know,
Yes.
one of my friends has lung cancer
Mm-hmm.
here where we live, and it's awful. It's awful. Do you want to talk about tobacco and vaping and marijuana at all for lung health? mean, I
Oh,
know
that's
that.
actually beyond the yeah. So we did a detox. Just detox means sweating. You know, just you can
Yeah.
do a hot bath or in the sauna room. So detox by it.
Uh-huh. Uh-huh. Oh, that poor
Drink
guy.
a lot of water before you
Yeah.
go to
He's like 60. He's
yeah.
70 years old, and he's smoking many years, and it's just destroying him. He want to have another one. I know how bad it is on the lung health. Um, and I don't know, the doctors, a lot of Chinese medicine is preventative. We're going to prevent problems
Mm-hmm.
now, exercise and uh, I guess if I would finding, don't you do like for the lungs where you strike the lungs like that?
Yes, yeah. You can use your palm like
Yeah. My wife will beat me on the back to get my lungs. Yeah.
yeah. The back is also because the lung need to kind of tap, make the energy move.
Well, and it wakes up the tissues and wakes up the fluids and the bloods, I guess. I mean, is that cupping they call that or no? That's not cupping. Cupping is when you pull out
Oh,
the
actually,
gum.
carping. We talk about carping is the best of all for that. Carping, you can use carping to do so much things for the lung. You can use just regular carping. You can use the moving carping. Use the one cup along the spinal. After a while, you can see the skin become red or sometimes black. So
It draws out toxin.
that's how toxicity. That's
Yeah.
one of the single most effective way for the lung conditions. Whether you have a tobacco poison or just like smoke, or you talk about the firefighter. So
Yeah.
coughing is really such a great thing to back or front some lung this area.
So, well, how does cupping work? Tell me more about it because I've heard of it, but I didn't know it worked for this. Cupping is I put in a cup and it draws out the toxin from the skin, right? No?
Yes, yeah, you use the vacuum. Actually, it's vacuum.
Yeah.
So
Yeah.
you just put on the skin, you put it to pull out the air, so suck to the stick on the skin. So actually, the skin is kind of stretched. Meanwhile, the old blood, we call dampness, we call stagnation, come to the surface. That's the best way to do it. Direct, more effective than antibiotic.
Who does it? Is it you have to go to a practitioner for that?
Yeah, there were certain techniques, certain things we need to skills we have to master. We don't want to cost too long. If you do yourself, make sure not too long. We keep the cups too long, might cause some blisters.
Well,
So
should people do these things themselves? I mean, should people
they
do?
can totally. I'm doing the
Oh,
training for
really,
those
really?
people.
Because I would be
Yes.
thinking, I don't want to do like it if I don't know what it is. I would put the tangerine in and use it in the steam.
Have a seat, Queen. Yeah, that would be good. So I'm more than happy if you have any question about the cupping, how to use it effectively, safely. I'm available to show you. You can message me and I can demonstrate with Zoom. Yeah.
Certainly, I'm very thankful for you too. And these sessions that we're trying to do now on the Zoom, I mean, this is our first one. I'm not sure it was, but you want to do these? Why you want to do these for free? Because you love everybody in the whole world, right?
Yeah, I love everyone become healthy, happy, enjoy life.
Yeah, you like to get, but so we want to do one a week, I guess. I hope it works.
Yeah, we do with our local time Thursday and 3 p.m.
Okay.
Bring all your questions.
Well, I think that if people are logging on, they can't ask a question. How do people ask a question? So we
Or
maybe
you
have,
can put it on the chatting box or message here. So I will get back to every question you posted here.
yeah, or they could leave a question before or after. That would work. But I
Yeah.
mean, because my lungs is bringing oxygen to everything, so lungs are most important for everything. And I know Chinese medicine, the blood quality is a big thing too. That
Yeah.
bring
So when the
the
energy flow, the lung function, so oxygen will will send to the different parts of organs. So our cells will be happy to function, to
Yeah.
give the activities we want to do every day.
Now I know that, and the lung tissue does regenerate. You get new cells, and it rebuilds itself, like or the throat tissue.
Yes. But all the process need the nutrients, which is oxygen and the minerals. So the keep a proper flow of energy, blood circulation is essential.
Sure, sure. What minerals would you suggest? I mean, for herbs, so maybe the herbs like minerals, like I take vitamins, I take zinc, I take magnesium.
Mm-hmm.
Sometimes what would you do? You have any favorites or favorite?
Yeah, I think vitamin C, zinc is a must for all the immunity.
For immunity, yeah, like
Yes.
the COVID, yeah, because you really can't stop the COVID with. I mean, we got the mask, but you know, the Chinese medicine is going to be like all these nurses and doctors. I think like if they want to feel from the stress and anxiety, you know, massage maybe. It's
Yeah,
gotta
if anybody knows the firefighter, policeman, or whoever frontier people likes to get your lung detoxified, I'm offer free the cupping therapy for the firefighters, for the policemen, whoever on the frontier.
Yeah. Okay. Well, I'll hold you on that. You're going to get 100 people down there. Be busy.
Yeah, I'm
That's
more
very,
than happy to help.
that's very generous. And you know, I know from experience, that's very, you know, you really have to get into it, but it does work. It can really
Yes,
make you,
that's work.
yeah, yeah, make you
Yeah.
feel much better.
So thank you very much, Julian. And I
No
enjoy being
problem.
here. And let's do next week. And yeah, everyone who wants to be healthier, use a holistic approach, welcome to join us on Thursday, every Thursday, 3 p.m.
We'll give it a try, Dr. Zhao, and I appreciate it. And peace and namaste to you. Do you want
Namaste
to
to
close it down?
everyone, to you. Thank you.
All right.